In this video, we dive into the signs of liver damage that you can't afford to ignore. Stick around until the end to get insights into how these symptoms can impact your overall health and what steps you can take if you notice them. Please like and subscribe to support our channel and stay updated with more content like this. Abdominal pain and swelling. Abdominal pain and swelling, particularly in the upper right part of the belly, is a common symptom associated with liver disorders. This area is significant as it houses the liver, one of the largest organs in the body, which plays a crucial role in numerous metabolic processes, including detoxification, protein synthesis, and the production of biochemicals necessary for digestion. The pain can range from mild discomfort to severe and debilitating pain. Swelling in this region often indicates inflammation or enlargement of the liver, medically known as hepatomegaly. Conditions that might cause these symptoms include liver cirrhosis, acute hepatitis, or fatty liver disease. Each of these conditions disrupts the liver's normal functioning and can lead to a buildup of fluid in the abdominal cavity, known as ascites, which contributes to the swelling. In liver cirrhosis, for example, the liver tissue is progressively replaced by scar tissue, which impedes the liver's ability to function and disrupt the blood flow through the liver. This increased pressure in the blood vessels around the liver often leads to swelling in the abdomen. Similarly, in acute hepatitis, the liver becomes inflamed and enlarged, stretching the membrane that surrounds it, which can be painful. Diagnosis of the underlying cause of abdominal pain and swelling typically involves a physical examination, blood tests to assess liver function, and imaging tests like an ultrasound or a CT scan. These help to visualize the liver structure and assess the extent of the swelling or damage. Treatment depends on the underlying condition, but generally focuses on reducing the symptoms and managing the primary cause. Lifestyle changes, such as diet modifications and avoiding alcohol, are often recommended. In more severe cases, medications or surgical interventions may be required to manage the condition and prevent further damage. Regular medical monitoring is vital for managing liver-related symptoms effectively. It ensures that any progression in the underlying liver condition is promptly addressed and that complications are minimized. Ascites. Ascites, the accumulation of fluid in the abdomen, is a serious condition frequently associated with advanced liver disease, particularly cirrhosis. This symptom arises when scar tissue in the liver obstructs blood flow through the portal vein, leading to increased pressure in the portal venous system, a condition known as portal hypertension. As pressure builds, fluid is forced out of the blood vessels and into the abdominal cavity. The presence of ascites is often an indicator of significant liver damage and can contribute to discomfort, increased abdominal girth, and weight gain. The fluid buildup can also impair breathing by putting pressure on the diaphragm, making it difficult for the lungs to expand fully. Diagnosing ascites involves a physical examination, where doctors may notice an increased abdominal size and a fluid wave test. Ultrasound or CT scans are used to confirm the presence of fluid and assess the volume. Blood tests to evaluate liver function and kidney function are also essential since these organs are closely linked in the management of fluid balance. The treatment of ascites primarily focuses on managing the underlying liver disease and reducing the fluid buildup. Dietary salt restriction is usually recommended to minimize water retention, and diuretics are often prescribed to increase the removal of fluid through the kidneys. Pale stool color, or stools that are light, white, gray, or clay-colored, can indicate significant issues with the liver or bile ducts. This discoloration occurs when there is a lack of bile in the stool, which is typically what gives stool its normal brown color. Bile, produced in the liver and stored in the gallbladder, plays a critical role in digestion, particularly in the breakdown and absorption of fats. If bile flow is obstructed or the liver is unable to produce bile due to disease, the stool will not receive its usual coloration. The causes of pale stools can range from blockages in the bile ducts, such as gallstones or tumors, to severe liver diseases including hepatitis, cirrhosis, or liver cancer. Additionally, conditions like cholangitis and inflammation of the bile ducts can also lead to pale colored stools. These conditions not only prevent bile from coloring the stool, but also impact the digestion and absorption of nutrients, leading to various other symptoms, such as weight loss and malnutrition. Diagnosis of pale stools involves evaluating liver function through blood tests, which can detect enzymes indicating liver stress or damage. Imaging studies, such as an ultrasound or CT scan, are essential to visualize the liver and bile ducts to identify possible obstructions or abnormalities. In some cases, an endoscopic procedure might be used to examine the inside of the bile ducts directly. Treatment targets the underlying cause and may involve medications to treat infections or liver inflammation, procedures to remove blockages, or surgery in cases of tumors or severe bile duct issues. Dietary adjustments and supportive therapies might also be recommended to manage symptoms and improve nutrient absorption. Increased sensitivity to alcohol and drugs. Increased sensitivity to alcohol and drugs, where effects are felt more quickly or intensely, is a notable concern in individuals with liver disease. The liver is essential in metabolizing both alcohol and most medications, breaking them down so they can eventually be cleared from the body. When liver function is compromised due to conditions such as hepatitis, cirrhosis, or liver cancer, its ability to metabolize these substances is significantly reduced. This impaired metabolism means that alcohol and drugs stay in the body longer, leading to increased effects and a higher risk of toxicity. For instance, medications may reach higher levels in the blood than intended, even at normal doses, causing side effects or adverse reactions that wouldn't typically occur in someone with a healthy liver. Similarly, even small amounts of alcohol can cause significant damage, as the liver is less capable of processing it, exacerbating existing liver damage. Diagnosis of this increased sensitivity typically involves reviewing the patient's medical history, current medication use, and liver function tests. Itchy skin. Itchy skin, known medically as pruritus, is a frequent and distressing symptom often associated with liver disease, particularly in conditions such as primary biliary cholangitis and cirrhosis. When the liver fails to function properly due to damage or disease, bile salts accumulate in the bloodstream instead of being excreted. These bile salts can deposit in the skin, leading to persistent or severe itching. The itching related to liver disease can be more intense in the palms of the hands and the soles of the feet, but can affect any part of the body. It can vary in intensity throughout the day, often worsening at night and impacting sleep quality. Unlike other types of itching that caused by liver disease, is not usually accompanied by a rash, although excessive scratching can cause secondary skin changes, such as thickening or infection. Diagnosis of itchy skin due to liver disease involves assessing liver function through blood tests that measure levels of liver enzymes and bilirubin. Additional tests, such as imaging studies and sometimes a liver biopsy, are conducted to determine the specific type of liver disease present. Treating itchy skin in the context of liver disease focuses on managing the liver condition itself. Medications may be used to help reduce bile acid concentration in the blood or to replace bile acids with ones that are less likely to cause itching. Therapies to improve liver function or manage symptoms directly, such as using antihistamines or topical ointments, are also common. Management of this symptom also includes general skincare measures like moisturizing regularly, avoiding irritants, and keeping the skin cool, as heat can intensify itching. Dark urine color. Dark urine color, significantly darker than usual, is often a warning sign of underlying health issues, particularly those affecting the liver or kidneys. In the context of liver disease, dark urine is typically caused by an increased concentration of bilirubin in the urine. This occurs when the liver, impaired by disease such as hepatitis or cirrhosis, fails to adequately process and excrete bilirubin through the bile and instead diverts more into the bloodstream, from where it is filtered out by the kidneys into the urine. The color of the urine may range from a deep amber to a dark brown, resembling the color of strong tea. This symptom usually accompanies other signs of liver dysfunction, including jaundice, pale stools, and abdominal swelling. The presence of dark urine is an indicator that the liver is not functioning properly and that bilirubin levels are elevated, suggesting significant liver impairment. Diagnosis of the underlying cause of dark urine involves a thorough medical history and physical examination, along with urine tests to measure bilirubin levels and other abnormalities. Blood tests are also performed to assess liver enzyme levels and overall liver function. Imaging tests may be required to look for structural problems in the liver and bile ducts. Treatment focuses on addressing the root cause of the liver damage. Depending on the diagnosis, this may include medications to treat liver infections or diseases, interventions to relieve bile duct obstructions, or lifestyle changes to reduce liver stress, such as abstaining from alcohol and adjusting diet. Chronic fatigue. Chronic fatigue, characterized by a persistent and overwhelming sense of tiredness or exhaustion, is a common symptom in individuals with liver disease. This fatigue is not merely feeling tired, It is a debilitating condition that significantly impacts daily functioning and quality of life. It arises because the liver, when damaged or diseased, struggles to perform its vital functions, including detoxification, metabolism, and energy storage, which directly influences energy levels. Liver diseases such as hepatitis, cirrhosis, and liver cancer can all lead to chronic fatigue. This symptom is particularly pronounced because the liver plays a crucial role in regulating various biochemical pathways involved in energy production. When the liver's ability to regulate these processes is compromised, it results in decreased energy production and increased feelings of fatigue. The exact mechanism of chronic fatigue and liver disease isn't fully understood, but it is believed to be associated with changes in neurotransmitter levels within the brain, particularly serotonin, which is involved in mood and sleep regulation. Additionally, the accumulation of toxins in the blood, which the damaged liver cannot effectively filter out, may also contribute to the overall feeling of fatigue. Diagnosing chronic fatigue involves a comprehensive evaluation to rule out other potential causes of tiredness and to assess liver function. This typically includes blood tests to measure liver enzymes, bilirubin levels, and other markers of liver health, as well as assessments for sleep quality and mental health to address all potential contributors to fatigue. Treatment focuses on managing the underlying liver condition and may include medications, lifestyle modifications such as diet and exercise, and sometimes interventions like liver transplantation in severe cases. Managing fatigue also involves strategies aimed at conserving energy, such as pacing daily activities, ensuring adequate rest, and possibly engaging in light physical activity, which has been shown to alleviate fatigue symptoms. Nausea or vomiting. Nausea or vomiting, persistent digestive discomfort, is frequently encountered in individuals with liver disease. This symptom arises because the liver plays a critical role in digestion by producing bile, which helps break down fats and absorb fat-soluble vitamins. When liver function is impaired due to conditions such as cirrhosis, hepatitis, or liver cancer, bile production and excretion can be affected, leading to digestive issues, including nausea and vomiting. These symptoms are particularly distressing as they can significantly impact an individual's ability to maintain adequate nutrition, leading to weight loss and malnutrition. Nausea and vomiting in liver disease may also be exacerbated by the accumulation of toxins in the blood, which the liver is unable to filter out due to its diminished function. These toxins can irritate the lining of the stomach and intestines, contributing to gastrointestinal discomfort. Diagnosis of the underlying liver issue involves a detailed medical history and physical examination, along with diagnostic tests such as liver function tests, imaging studies like ultrasound or CT scans, and possibly endoscopy to visually assess the gastrointestinal tract. Dietary changes, such as eating smaller, more frequent meals and avoiding fatty or spicy foods, can also help manage these symptoms. In severe cases, nutritional support through intravenous fluids or supplements may be necessary to ensure adequate nutrition. Effective management of liver disease and its symptoms, such as nausea and vomiting, requires ongoing medical care and regular monitoring to adapt treatment plans as needed and prevent further complications. Loss of appetite. Loss of appetite, a significant reduction in the desire to eat, is another common symptom associated with liver disease. This reduction in appetite can be due to various factors linked to liver dysfunction, including altered metabolism, changes in taste and smell due to accumulated toxins, and the general malaise and discomfort that often accompany liver issues. Liver diseases such as cirrhosis, hepatitis, and liver cancer disrupt the liver's ability to regulate metabolism and detoxify the blood, which can lead to a buildup of toxins. These toxins can affect the brain and gastrointestinal system, leading to symptoms like nausea, which further decrease appetite. Additionally, the liver's role in digesting fats is compromised, which can make eating feel uncomfortable or unappealing. The impact of a reduced appetite is profound as it can lead to inadequate nutritional intake, weight loss, and muscle wasting, all of which are detrimental to overall health and can exacerbate the severity of liver disease. The decrease in nutrient intake can also impair the body's ability to heal and fight infections, making recovery from liver disease more challenging. Diagnosing the cause of loss of appetite in the context of liver disease typically involves comprehensive liver function tests, nutritional assessments, and evaluations for possible complications of liver disease such as ascites or encephalopathy. Dietary modifications to include small, frequent, nutrient-rich meals can also help enhance appetite and ensure sufficient caloric intake. Managing loss of appetite effectively is crucial for maintaining the health and quality of life of individuals with liver disease, requiring ongoing care and regular monitoring by healthcare professionals to adjust dietary recommendations and treatment as necessary. A tendency to bruise easily, with bruises appearing without much injury, is a notable symptom often observed in individuals with liver disease. This increased susceptibility to bruising is primarily due to the liver's impaired ability to produce clotting factors, which are proteins vital for blood clotting. Liver conditions such as cirrhosis, hepatitis, or liver cancer can significantly reduce the liver's capacity to synthesize these essential proteins, resulting in a tendency for blood to clot more slowly, thereby increasing the risk of bruising from even minor bumps or injuries. Additionally, liver disease can lead to thrombocytopenia, a condition characterized by a low platelet count. Platelets are another crucial component of the clotting process, and their reduced levels further contribute to easy bruising and also raise the risk of bleeding more generally. Easy bruising might not only be more frequent, but also more pronounced, with larger and darker bruises that take longer to heal. This symptom, while often concerning aesthetically, also serves as an important clinical indicator of the severity of liver dysfunction. Preventative measures to minimize bruising, such as protecting against falls and avoiding medications that thin the blood, are also recommended. Regular monitoring and medical supervision are crucial to effectively manage the risk of bruising and bleeding in patients with liver disease, ensuring that changes in symptom severity are promptly addressed. High blood pressure in the veins that supply the liver. High blood pressure in the veins that supply the liver, known medically as portal hypertension, is a significant condition often associated with serious liver diseases, such as cirrhosis. This occurs when scar tissue within the liver obstructs the normal flow of blood through the portal vein, which is the major vessel that carries blood from the digestive organs to the liver. As a result, the pressure in this vein rises, which can lead to various complications. One of the primary consequences of portal hypertension is the development of varices, which are enlarged veins typically found in the esophagus or stomach. These varices are at risk of bursting, leading to serious bleeding. Portal hypertension can also cause fluid to accumulate in the abdomen, a condition known as ascites, and can contribute to the swelling in the legs and the development of other symptoms like abdominal pain. In severe cases, procedures like placing a shunt inside the liver or other surgical interventions might be necessary to redirect blood flow and relieve the pressure in the portal vein. Ongoing management and regular medical checkups are vital to monitor the effectiveness of the treatment and to adapt it as necessary, ensuring that further complications are prevented and the patient's quality of life is maintained. Weight loss. Unexplained and sudden weight loss is often a concerning symptom in individuals with liver disease, particularly those suffering from conditions like liver cancer or severe cirrhosis. This weight loss can occur as the liver struggles to perform its essential functions, including metabolism and detoxification. As liver disease progresses, it can impair the body's ability to process nutrients and fats, leading to a reduction in stored fats and muscle mass. The mechanisms behind weight loss in liver disease are complex and include decreased appetite, malabsorption of nutrients due to impaired bile production, and increased metabolic demand from the body trying to combat the illness. Additionally, nausea and changes in taste common in liver disease can significantly reduce the desire to eat, further contributing to weight loss. Diagnosing the cause of weight loss involves a thorough evaluation, including a detailed medical history to rule out other potential causes of weight loss. Diagnostic tests such as blood tests to assess liver function and nutritional status, imaging studies to examine the liver and other organs, and possibly a biopsy if cancer is suspected, are essential. Treatment focuses on addressing the underlying liver condition while also attempting to stabilize weight and improve nutritional intake. This may involve nutritional support, either through dietary counseling to ensure a high-calorie, nutrient-rich diet, or through supplements. In some cases, medications may be used to stimulate appetite or manage symptoms like nausea that interfere with eating. Management of unexplained weight loss in liver disease patients requires regular monitoring and adjustments to treatment plans based on the progression of the liver disease and the individual's overall health. Gynecomastia. Gynecomastia, the development of breast tissue in men, is another symptom that can be associated with liver diseases, especially chronic liver disorders such as cirrhosis. This condition results from an imbalance in the hormonal metabolism caused by the liver's impaired ability to regulate hormones. Specifically, Liver disease can lead to increased levels of estrogen and decreased levels of testosterone, which promotes the growth of breast tissue in males. The liver plays a crucial role in the metabolism of hormones, including the breakdown of estrogens. When liver function is compromised, estrogen levels remain elevated, which stimulates the growth of breast tissue. This can be distressing and embarrassing for affected individuals, impacting their emotional and psychological well-being. Diagnosis of gynecomastia involves a clinical examination to assess the extent of breast tissue enlargement and distinguish it from other possible causes like fat deposition, which can appear similar but is related to weight gain rather than hormone imbalance. Blood tests are also conducted to measure hormone levels and liver function tests to evaluate the liver's health. Treatment focuses on addressing the underlying liver condition to improve hormonal balance. If liver function improves, hormone levels often normalize, reducing breast tissue growth. In some cases, medications may be prescribed to adjust hormone levels directly. For persistent gynecomastia that causes significant discomfort or psychological impact, surgical options to remove the excess breast tissue may be considered. Management of gynecomastia in the context of liver disease also involves regular monitoring of liver health and hormone levels to prevent recurrence and manage symptoms effectively. Spider angiomas. Spider angiomas, also known as spider nevi, are a common symptom associated with liver disease, particularly in conditions where liver function is severely compromised, such as cirrhosis. These are small, spider-like blood vessels visible on the skin. Spider angiomas consist of a central red spot and reddish extensions which radiate outwards like a spider's web. They are most commonly found on the face, neck, upper part of the torso, and arms. The development of spider angiomas is linked to elevated levels of estrogen in the blood, a condition often seen in liver disease. The liver is responsible for metabolizing estrogen, and when its function is impaired, estrogen levels can rise. High levels of estrogen increase the growth of small blood vessels, leading to the formation of spider angiomas. Typically, spider angiomas are harmless and do not cause discomfort, but they can be a visible indicator of liver disease severity. The number and visibility of these angiomas often correlate with the degree of liver dysfunction. More severe liver disease may result in a greater number of lesions. Diagnosing spider angiomas involves a simple visual examination. Their distinctive appearance generally makes them easy to identify by healthcare professionals. While no specific treatment is required for the angiomas themselves, their presence may prompt further investigation into liver health and function. Treatment and management of spider angiomas focus primarily on addressing the underlying liver condition. Improving liver health can stabilize hormone levels and may reduce the appearance or prevent the proliferation of new angiomas. If the appearance of spider angiomas is distressing to the patient, options such as laser treatment can be considered to reduce their visibility. Lifestyle modifications, such as abstaining from alcohol and maintaining a healthy diet, are crucial. Medications may be prescribed to manage specific liver conditions, and in severe cases, surgical options like liver transplantation might be considered. Mental confusion. Mental confusion, often referred to as hepatic encephalopathy when related to liver disease, is a condition where brain function deteriorates due to the liver's inability to remove toxins from the blood. This symptom is significant because it indicates severe liver dysfunction. Typically, the liver helps to filter and eliminate harmful substances from the blood. However, when it is damaged, as in cases of cirrhosis or acute liver failure, toxins such as ammonia accumulate in the blood and travel to the brain, disrupting normal brain function. Symptoms of hepatic encephalopathy include difficulty remembering, concentrating, changes in sleep patterns, mood swings, and in severe cases can progress to disorientation, severe confusion, and coma. These neurological impairments occur because the toxins interfere with neurotransmission, the way nerve cells in the brain communicate. Dietary changes, including protein restriction, might also be recommended to decrease ammonia production. Managing hepatic encephalopathy requires careful monitoring and adjustment of treatments to improve symptoms and prevent progression. Regular medical evaluations are crucial to manage the underlying liver disease effectively and to address any changes in mental function promptly. Weakness. General weakness, a pervasive feeling of being physically weak, is a common symptom experienced by individuals with liver disease. This weakness is not just a feeling of tiredness, but a profound lack of energy that affects one's ability to engage in daily activities. It often accompanies other symptoms such as fatigue, but it specifically refers to a reduction in muscle strength and endurance. The liver plays a crucial role in various metabolic processes, including glycogen storage, the conversion of ammonia to urea, and the synthesis of proteins from amino acids. When liver function is compromised, these processes are affected, leading to muscle wasting and a decrease in physical stamina. Additionally, the accumulation of toxins in the blood, which the liver would normally filter out, can negatively impact muscle function and nerve conduction, contributing to overall weakness. Diagnosis of general weakness in the context of liver disease involves assessing overall liver function through comprehensive blood tests, which can provide information about liver enzymes, bilirubin levels, and other relevant markers. A physical examination and a review of the patient's medical history help distinguish weakness due to liver disease from other potential causes. Treatment is directed at managing the underlying liver condition with medications to improve liver function, dietary modifications to support liver health, and possibly interventions to address specific complications of liver disease. In cases where muscle wasting is pronounced, physical therapy might be recommended to help improve muscle strength and endurance. Supportive care, including ensuring adequate nutrition and hydration, is also crucial, as these are essential for maintaining muscle mass and overall physical condition. Jaundice. Jaundice, characterized by the yellowing of the skin and eyes, is a visible sign that typically indicates a problem with the liver or bile ducts. This yellow coloring results from an excess of bilirubin, a byproduct of the breakdown of red blood cells. Normally, the liver processes bilirubin, which is then excreted through the bile into the intestines. However, if the liver is damaged or the bile ducts are blocked, bilirubin builds up in the body, leading to jaundice. This condition can signal several underlying health issues, primarily disorders related to the liver, such as hepatitis, cirrhosis, or liver cancer. It can also be caused by conditions that lead to the destruction of red blood cells at a rate that overwhelms the liver's ability to remove bilirubin from the blood, known as hemolytic anemia. Additionally, blockages of the bile ducts, such as gallstones or tumors, can prevent the excretion of bilirubin and cause jaundice. Jaundice is not just a disease, but a symptom of these various underlying conditions. It often appears in conjunction with other signs such as dark urine, pale stools, and itching, reflecting the severity and cause of the liver impairment. The onset of jaundice can be gradual or sudden, depending on the rate at which bilirubin accumulates in the blood. Diagnosing the exact cause of jaundice involves a series of tests, including blood tests to evaluate liver function, imaging studies such as ultrasound or CT scans to view the liver and bile ducts, and sometimes liver biopsy. Treatment of jaundice focuses on addressing the underlying cause. For instance, if a viral infection like hepatitis is responsible, antiviral medications may be prescribed. In cases of obstruction, surgical procedures may be required to remove the blockage. Managing jaundice effectively depends on early detection and comprehensive care to prevent serious complications such as liver failure. Regular monitoring and follow-up care with healthcare providers are crucial for individuals diagnosed with jaundice to ensure effective management of their condition. Fever. Unexplained persistent fever, often occurring in individuals with liver disease, can be a sign of an underlying infection or inflammation related to the liver condition. The liver plays a crucial role in regulating the body's immune response and filtering out pathogens. When liver function is compromised, as in cases of hepatitis, cirrhosis, or liver cancer, its ability to combat infections diminishes, making the body more susceptible to infections, which can present as fever. The fever may be persistent or intermittent and is typically accompanied by other symptoms of liver disease such as jaundice, abdominal pain, or an overall feeling of being unwell. This symptom is particularly concerning because it can indicate a progressing infection or inflammation that requires immediate medical attention. Diagnosing the cause of fever and liver disease involves a comprehensive evaluation, including blood tests to assess liver function and detect markers of infection. Managing the primary liver disease is also crucial to improve the liver's health and reduce the risk of further infections. Supportive care, including the use of antipyretics to manage fever and regular monitoring of vital signs, is essential to ensure that the patient remains stable and to prevent complications from high fever or the underlying liver disease. Blood in stool. Blood in the stool, a sign of bleeding in the digestive tract, is a serious symptom that can be associated with liver disease, particularly in those with advanced liver conditions like cirrhosis. The presence of blood in the stool can appear as red blood or a darker tar-colored stool, depending on where the bleeding is occurring in the gastrointestinal tract. The darker, tar-like appearance, known as melena, results from the digestion of blood as it passes through the intestines, indicating bleeding from an upper gastrointestinal source. In liver disease, one common cause of bleeding is the development of enlarged veins in the esophagus or stomach, known as varices. These varices are prone to rupture due to the increased pressure from portal hypertension, a condition where blood flow through the liver is obstructed by scar tissue. When these veins burst, they can cause significant bleeding, which may manifest as blood in the stool. Diagnosing the source of gastrointestinal bleeding involves endoscopy, a procedure where a camera is used to visually inspect the esophagus, stomach, and upper part of the small intestine. This method can directly identify varices or other potential sources of bleeding. Additional tests, including blood tests to assess liver function and measure blood clotting abilities, are also essential. Treatment for blood in the stool focuses on stopping the bleed and managing the underlying liver disease to prevent further episodes. If varices are the source, procedures such as banding, tying off the varices with special bands, or sclerotherapy, injecting them with a solution that closes them, are commonly used. Medications that reduce portal hypertension, like beta blockers, are also prescribed to lower the risk of future variceal bleeding. Regular monitoring and preventive care are crucial for patients with liver disease to manage and reduce the risk of serious complications like gastrointestinal bleeding. This includes routine endoscopies to check for the presence and progression of varices. Swollen legs and ankles. Swollen legs and ankles resulting from fluid retention are common symptoms in individuals suffering from liver diseases, such as cirrhosis or severe liver dysfunction. This condition, medically known as peripheral edema, occurs when the liver is unable to synthesize albumin adequately. Albumin is a protein that helps maintain the oncotic pressure necessary to keep fluid in the bloodstream. Without sufficient albumin, fluid leaks out of the blood vessels and accumulates in the tissues of the legs and ankles, causing swelling. This symptom is often exacerbated by gravity, particularly after prolonged periods of standing or sitting. The swelling can vary throughout the day, typically worsening in the evening and improving after a night's rest. Aside from discomfort and an increase in size, swollen legs and ankles might feel tight or stiff, and the skin may appear stretched and shiny. The presence of edema in liver disease is also closely linked to portal hypertension, which is high blood pressure in the veins that supply the liver. Portal hypertension can lead to the accumulation of fluid in the abdominal cavity, known as ascites, which often occurs in tandem with peripheral edema. Diagnosing the cause of swollen legs and ankles involves a physical examination and may include blood tests, urine tests, and imaging studies to evaluate liver function and structure. A healthcare provider may also check for other symptoms like jaundice, abdominal swelling, and changes in urine or stool color to confirm the diagnosis. Management of swollen legs and ankles in the context of liver disease focuses on treating the liver pathology itself. This may involve medication to reduce high blood pressure in the liver's veins or procedures to drain excess fluid. Additionally, lifestyle modifications such as reducing salt intake, elevating the legs when sitting, and wearing compression stockings can help alleviate the symptoms. Effective management requires regular follow-ups to monitor the underlying liver condition and adapt treatment plans as needed to prevent further health complications. That's all for the signs of liver damage. If you're looking for more health advice, click the video on the screen right now to keep watching. Your support through likes and subscriptions is greatly appreciated.